Today, I'm going to be presenting my presentation on the trapezius muscle. The trapezius muscle is it's a commonly mistaken muscle because normally when we think of the trapezius, we just think about it like the small part on top of our clavicle area. But it's actually a way bigger muscle than that. It's one of our largest muscles. I think it's basically our second largest muscle, just behind latissimus dorsi when we're talking about upper body and posterior muscles. So another thing to take note when talking about the trapezius muscle is that it plays a large part in our posture. We don't really think about it when we think about our posture, but if you ever see someone crouching down or being very slouched, it could be because they have a very weak trapezius. But another thing about the trapezius is that it gets its name from its shape because it looks like a trapezoid. And yeah, as I previously stated in the last slide, the trapezius is a big muscle. It can be divided into three parts: the upper fibers, the middle fibers, and the lower fibers. The lower fibers are what runs down in the spine from T12 to C7, around there, and it's a triangular shape. While the middle fibers are the ones that run across. A good way to think about it is that the middle fibers run across from shoulder to shoulder, while the upper fibers are the ones that are the posterior side of your neck. They're covering it, in a way guarding it from whiplash. However, they don't tend to be the strongest parts of the muscle. That would probably be the lower fibers because it's more condensed and more heavy in that area. The upper fibers are kind of fragile compared to that, but they still provide some protection. While the middle fibers are the ones that run across. A good way to think about it is that the middle fibers run across from shoulder to shoulder, while the upper fibers are the ones that are the posterior side of your neck. They're covering it, in a way guarding it from whiplash. However, they don't tend to be the strongest parts of the muscle. That would probably be the lower fibers because it's more condensed and more heavy in that area. The upper fibers are kind of fragile compared to that, but they still provide some protection. It then continues in the middle fibers, as the origins for the middle fibers are the spheniceous process of the 7th cervical and the upper 3 thoracic vertebrae, still all in the middle of the spine. Finally, the lower fibers originate from the spheniceous process from the 4th to the 12th thoracic vertebrae. They're all running down. Now, in the beginning, it might be a bit confusing how they have all three different origins, but once we break it down and identify the different parts, it's kind of obvious once we really think about it. And if it's true for the origins, it's going to be true for the insertions as well, as the upper fibers are inserted into the lateral third of the clavicle. The middle fibers are inserted into the medial border of the acromion process and the upper border of the scapular spine. And finally, the lower fibers are inserted into the triangular space of the base of the scapular spine. So basically, the insertions would happen to be the lateral third of the clavicle, the acromion process, and then the scapular spine. Now, moving on to the action of the trapezius. There are many different beliefs on what action does the trapezius take part. However, I'm going to be using the one given to me by the study guide that Professor Lonsdale made in order for us to get ready for the exam. So, I'm going to break down the actions by the fibers. The upper fibers is in charge of elevation, the middle fibers are in charge of elevation and retraction, and the lower fibers are in charge of depression and retraction. Now, this is just a rough estimate. They do, however, take part in other actions and help out, but just to keep it simple, this is what I'm going to be using, okay? Exercises for the traps vary. They vary on the individual and they vary on the individual's ability. For example, an individual might not be able to do a pull-up or a dip, and instead might need something that's more guided, like a cable roll or something more limited of that sort. But overall, the breakdown of the exercises go like this. If you're trying to work up the upper fibers of the trapezius, dumbbell shrugs or deadlifts are the way to go. You can change the weight, and in case dumbbells are still too difficult, you can try in free body weight and just try to do the motion. To work out the middle fibers, some good exercises would be cable rolls or reverse dumbbell flies. Of course, you don't need to do cable rolls with weight. You can do cable rolls with an elastic band, and you can do different types of modifications in case you're unable to do some of these exercises. For the lower fibers, there's the lat pull down, and then there's pull-ups. Of course, the pull-ups are the higher level ones. They're more for somebody that's already has good core strength, good muscular strength, and wants to improve on that. A lat pull down would be more beneficial for somebody that is more injury prone or is in more pain. Some stretches that might help out a tight trapezius would be like the upper trap stretch. The upper trap stretch is a stretch in which you're sitting down, you have your shoulders leveled, and then you try to make your ear touch your shoulder. You obviously don't want to do it in a rapid motion, but you want to do it in a controlled motion where you feel the stretch. If the stretch is not feeling like a good enough stretch, a thing that you can do is press down on it with your hand, like it's shown with the lady on the picture that's sitting down and putting more pressure. That helps the stretch magnify. Another stretch that might be beneficial would be the cat camel stretch. You first want to have an arch in your back to represent the cat, and then you want to just take a deep inhale and then come back to normal to represent the camel. This should help out loosen up some of that tightness in your trapezius. Another exercise that might be beneficial would be chin tucks, although not an exercise but more of a stretch, in which you can do it either. If you want to make it easier for yourself, you can do it laying down, putting pressure down on a pillow. If you want to make it more difficult, you can do it just sitting down and then doing it backwards. If you want to make it really difficult, you can do a reverse chin tuck in which you're on all fours, and instead of the chin tuck going down like in the easy way, laying down, the opposite can be more harder, but it's going to give you a better stretch and more pressure to it. Common injuries. Common injuries for the trapezius include, but are not limited to, muscle spasm, muscle tightness, swelling / headaches. Swelling can cause headaches if it swells too much and there's too much inflammation going on, that it can cause, since it's messing with a lot of nerves, it can cause some types of headaches. But overall, the main causes for these types of injuries are normally just repetitive motion. If you're doing an action too much, it may harm your trapezius. Like, for example, lifting or resistance training, or even things like, for example, swimmers. Swimmers experience pain in their trapezius due to the repetitive motion of swimming. However, not all hope is lost whenever you're having an injured or you ended up hurting yourself or hurting your trapezius by extension. But some things that you can do is just little massaging sometimes helps. Rest is obviously a great thing, and in some cases physical therapy is needed, but in very severe cases surgery might be needed, in which case it might take a longer time for recovery. It just depends on how bad a strain is or how bad the injury is when it comes to dealing with a situation like that.